Hello, everybody, and welcome to the Pain-Free Living Experience. I am Samantha, and in this session, we are going to talk about who I am and why you should listen to me in the first place. All right, who am I and what do I know about pain? Why would you even listen to me? What is the point, right? So I have been a high-level athlete my entire life. I played many sports. I wanted to be a gymnast, all of these things. So I ended up going to school and graduating for massage therapy in 2000. So that was like 25 years ago. I literally cannot even believe it. I was a professional dancer and dance teacher. I trained myself then in aerial acrobatics. So I was doing silks and trapeze. I was a flyer for doubles trapeze. I've been a fire performer for many years. I've done like 3 different yoga teacher trainings. I'm an equestrian. I work with horses. I used to compete in horseback archery before I went to school and was studying physical therapy. So I have been a physical therapist assistant since 2011. So this is me and all my glory. So you can see I used to do silks, flyers for doubles trapeze. I taught belly dance for a number of years, riding horses, and then doing fire performance. So I am no stranger to how the body works, and also more importantly, watching movement. So training dancers and watching how they move and the muscles that they're firing and all of these things has really led me to do things a little bit differently, I think. So I ended up going to school for physical therapy, and we are going to talk about that in just a few minutes. I've worked in many aspects of physical therapy. So over 11 years of experience. When I first got out of school, I was working in acute care, which is a hospital-based rehab. I am that jerky face who would come and get you out of bed after your surgery or after whatever accident. I spent a long time working in stroke rehab, spinal cord injuries and amputations. So like the lowest of the lowest level, right? Where people literally have to learn how to roll over in bed, how to get up, how to walk again. And so I did a lot of work in land therapy and also in aquatic therapy, literally retraining people how to get their functional mobility back. It was very, very hard work. Because of this, again, I'm very accustomed to watching people and seeing what muscles are firing, what is not firing, and where the gap is. So then, that was really hard work. And also, like working with people in the lowest phase of their life. Like I entered their life during the hardest places that people were. And that was very challenging emotionally, to be honest with you. And also very challenging to see how families treat their family members. And so I ended up working in outpatient. So I went to outpatient rehab, was doing a lot of joint replacement work. I have seen every joint replacement surgery that there is to be done, lots of balance training, and then a lot of pain relief. And because I came in to this work already having a background as a massage therapist, it really gave me a leg up. A very good friend of mine was running the women's health clinic for Mission Health. And so I came in and started working under her, doing scar tissue mobilization, post mastectomy, and managing lymphedema. So I did go ahead and become a lymphedema therapist. And then, because of my own injuries with my pelvic floor, I ended up learning that I had pelvic floor dysfunction, and then going and taking all of the continuing education to become a pelvic floor therapist. So I have a lot of experience working with people in pain, working with people pre-surgery, post-surgery, all of the things. So I know a little bit about what I'm talking about. I also know what it's like to struggle with chronic pain. And that's really what brings us to the crux of why this program exists. I've been in 7 car accidents before I was the age of uh like 21 even. I mean, just repetitive injuries, right? And I was told that I had the neck of a 90-year-old woman when I was 28 years old. So I was going to chiropractors because I literally could not turn my head from side to side. I had daily headaches, migraines. I was miserable. I had a very low quality of life, despite the fact that I was doing all of these amazing things. I hurt from head to toe 150% of the time. It and I also was not my best self. So I know what it's like to not be your best self when you're interacting with your family, your spouse, your children, anybody in your community, and like how draining it can be to be in chronic pain 24/7. So what really was so I was going to chiropractors, I was going to all of these things, and they're like, oh, your cervical curve is reversing. That's why you're in so much pain. And they would snap, crackle, and popple me. But nobody ever talked to me about the way I was holding my body, the way I was holding my head, the way I was doing things, the way I was utilizing my phone, the way I was sitting at the computer. And these were like big pieces of the puzzle. They also were not teaching me how to release the muscular tension from all of this trauma over the years. So moving on, I was the flyer for doubles trapeze and doing a lot of trapeze, and I ended up injuring my shoulder. And because of that, I couldn't lift my arm up over 90 degrees. And I couldn't lift my arm up over 90 degrees for a year and a half. I was in 8 out of 10 pain 100% of the time. I could not sleep. I could not use it. I was constantly like 100% of the time just messing with my shoulder. I probably saw 25, 26 different massage therapists, who it just didn't touch the pain. I saw like 4 different chiropractors. I went to physical therapy. I thought it was an absolute joke. I walked out on physical therapy. I was yelling at people, like I was in a lot of pain. I had a cortisone injection in my shoulder. It did nothing. So, like, again, I understand what it's like to be running around to all of these people to help you, and they can't help. And at the same time, I was in school for physical therapy and I was not learning one thing there. Nothing was helping. No little ultrasound, no little e-stim machines that go beep. None of it worked. Giving me these piddly little exercises. Like, seriously, if doing this with the band was going to be the thing that changed my life for the better, like everybody would do that, right? But it did not help me. It was not helping me. And I was blowing money like crazy. And I was in school for something that I didn't believe in. And so I was super depressed. And I also had a young son, you know what I mean? So I had to show up and be there for him with the stress of raising another human being. Like, it was not a good time. It was not a good time in Samantha Land. And then so I remember seeing somebody who actually did help me with my shoulder. And this was way later on in the journey. And I was just like, wow, like in 3 sessions, I had full range of motion and no pain in my shoulder. And that's when I was like, oh, this physical therapy thing is a joke. And I want to learn everything that this person knows. So I ended up taking all of her continuing ed that she was teaching for massage therapists. And because by this point I was graduated and working in physical therapy, I was able to implement every single thing I was learning. And guess what I started learning? That my clients were getting better, because what I didn't want to be was some therapist, you know what I mean, that couldn't help people. And so when you're going to these people, you don't know what you're going to get. You do not know what you're going to get. You don't know if you've got somebody who's totally burnt out and just doesn't really care anymore, because those people exist. You don't know if you've gotten somebody who's a fresh out of school new grad with all of the positive intentions in the world, yet none of the experience to back it up. You don't know what you're going to get. So you're just going to this random person, asking them to help you, and you're not even really entirely sure if they're a great therapist. And if you've been to physical therapy, then you know sometimes you go to physical therapy and you don't even see the same person from time to time. It's random. Sometimes they're working with more people than just you. And like, I've talked to a lot of people who think that it is an absolute joke. And I can agree with that. In my experience, it was an absolute joke. And then the worst thing is like when they tell you to do something and then they turn around and walk away and they don't even watch you, don't even watch if you're doing it right and all of the things. So I was a little disenchanted with my career choice, to say the least. But then I was working in physical therapy for like a very long time because I went to school for it. And at a certain point, I was experiencing pelvic floor dysfunction. And I was experiencing pelvic floor dysfunction for 4 years. So again, I know chronic pain. I know chronic pain. My pelvic floor injury sent me to the emergency room where they did all of their little scans and diagnosed me with a tummy ache. And gave me some muscle relaxers for that, like you would any 2-year-old with a tummy ache. And then sent me to my OB who didn't know what was going on. And I just ended up spinning my wheels and going to all of these people who couldn't help me. And it was super frustrating. I thought I was going to be stuck like that forever. And I had radiating hip pain going down my leg, going into my back. I could not stand on my right leg and put my pants on anymore. Like I couldn't really stand on that leg and do anything. I couldn't sleep. It would, like I know chronic pain. So I ended up working for a pelvic floor therapist when I moved to Florida. And I was doing everything. I was doing the traction, I was doing exercises, I was doing the therapeutic foam rolling stuff that I do. And I was just missing something. Like I couldn't touch it. I couldn't touch the pain. And so I asked her to check me out. She went and did an internal exam, released these muscles inside of my pelvis. I lit up like a Christmas tree with all of this pain. And then it all went away. Every single symptom I had went away. And now I'm 46 years old. I do not have any pain. I feel better now than I did in my 20s. And because of what I learned and because of what I know, I created Not Now Therapeutics for you so that you don't have to go through the things that I went through, so that you have somebody in your corner who knows what it's like to live in chronic pain and who knows what it's like to overcome chronic pain for themselves without pills, without injections, and without surgery. Because let's just face it, this stuff doesn't really get to the root cause of why you're living with chronic symptoms. So I created what I call the I Heal method. So these are the pillars of what I think is really important for you to be able to get out of chronic pain. I is information, information about why you might be experiencing symptoms. If you don't know what's going on, chances are you can't fix it. So I give my clients hands-on strategies. And what does that mean? I teach them how to release their own muscular tension using foam rollers and using balls. And this is not just like wallowing around on the floor, like indiscriminately and spraying and praying and hoping, right? This is targeted, this muscle and why relief from chronic symptoms. Because if you are having joint pain, you have a problem with your muscles. True core strengthening exercises. True core strengthening, not a bunch of crunches and like all of these things, but really working on stabilizing the joints so that you can move without compensating. And then we talk about accountability for the things that you are doing, because chronic pain comes from things that you are doing with consistency and time. Chronic pain did not just fall on top of you. It was created by your actions and your daily habits. Sorry. And then I'm going to teach you how to live your best life free from chronic pain through healthy habit forming and creating sustainable daily practices that support your health. Because you have to take care of your body. It's the only place that you have to live, literally. And most people don't want to live in this house. This house is crumbling at the foundation. Like, this house has not been maintained. There is no, like, where do we even start, right? Like, just got to demo this house and start over. And a lot of people are living in that body, right? Their foot hurts, their knee hurts, the hip hurts, the back hurts, the shoulder hurts, everything hurts. We don't know where to start. We don't know what to do. Even going to people hurts, and you don't have any support and you don't have any self-care strategies, and you feel like you're going to be stuck like this forever. Chances are we all know somebody living in that house. When most people want to live in this house, something that's been maintained. The house doesn't maintain itself. Chances are, if you live in an actual house that looks like this, you might be spending more time maintaining your house than you are your own self, right? Because this yard is trimmed, all the lights are working, like all of the things, right? This house is not crumbling at the foundation. This is more the type of house that we want to be living in. And the metaphor here for your body is you have to do maintenance for yourself. You have to be doing things that are good for you if you want good things out of you. Because chronic pain typically, observe the word typically, occurs in muscles that are stretched out and weakened over time because of our habits. So if you are always looking down at your phone, you are going to have neck and mid-scapular pain because these muscles get stretched out and weakened. If you have back pain, like millions and millions and millions of people in America do, chances are you may have a poor sitting posture that stretches out your low back. Back and the neck are some of the biggest deal problem areas. And it's because we sit and we sit and we sit and we sit and we're slouching forward, and these muscles get stretched out and weakened over time. Time and consistency is the secret sauce for everything amazing and awful. If you sit with your legs crossed, chances are you have outer hip pain because the femur head is pushing out into your gluteus medius and minimus. This can stop at any time. The way you sit, the way you stand, the way you walk, the way you move through life have an action on your body. And pain is not just happening to you. It was created with time and consistency. And if it can be created, it can be uncreated. Knees. We sit all weird, stretched out. I hope that this is starting to make sense to you. So In the next sections of the pain-free living experience here, I am going to be breaking on the information section. I'm going to be breaking down some of the common chronic pain conditions. And more importantly, I'm going to talk to you about things that you can do about it. See you in the next section.